you have stepped outside this morning, likely you are still seeing and smelling all the smoke in the air because of the wildfires we have burning around Northern California. Our air quality is just awful right now.
It's bad. Dr. Matthew Donnelly from Dignity Health joins us live now to talk about how it's impacting our health and what we can do right now to stay healthy, even when we're inside. Doctor, good morning.
Good morning. Thank you for having me.
What do you suggest that we can do with all this smoke out there? It's really aggravating our eyes and our throat.
Yeah, I mean, if you look out on the ground and on your cars, you see the ash out there. If you look out into the sky, you can see there's a lot of haze. And if you consider how much is on the ground, you can actually see that. The problem is this small particulate matter that makes up the smoky air that you breathe in. That's the stuff that's really causing problems, and there's a lot of it. So if you're breathing that in, it gets down deep into the deep parts of the lungs. It causes irritation and inflammation down there. And really the only way to stay healthy in this setting is to avoid exposure, to do everything you can to try and not breathe that in.
Which is pretty challenging because we were just looking at some video of, big office buildings in downtown Sacramento, and one of the recommendations for COVID was to bring more outside air in to circulate it in a lot of those buildings. That outside air is just, awful right now. Do air purifiers work? I mean, a lot of people have turned to putting things like that in their home to try to improve the air.
A good high quality air purifier with a HEPA filter can improve air quality within your house. And actually, if you run your AC and you have a good filter like MER 13 or better, you can run it on and the fan will continuously run and recirculate the air and filter the air through that filter. That'll decrease the amount of particulate in the air inside of your house.
That's a good tip. Some of the symptoms that people encounter when they're around bad air, an irritated throat, a runny nose, irritation with your eyes, a lot of those are a lot of the symptoms that we're also asking people about COVID, which I think has people feeling very uncomfortable. Any thoughts on that?
That's an interesting point, and it's a good question. We get it often. COVID's a little bit different in that you should be having other symptoms associated with it. You should be having fever, muscle aches, the similar stuff you would think if you had the flu. So I think if it's separate and you're just having the irritation of your eyes and your nose and your throat, it's probably more likely to be due to the smoke exposure than it is COVID-19.
And doctor, who's at most risk right now? I know my children have been asking to play outside for, distance learning, and I haven't taken them outside, but what is the recommendation for them? I mean, a mask won't help, it doesn't sound like.
Well, certain masks will help, like an N95, but we're trying to reserve those for frontline medical workers. But the cloth mask and the surgical masks that are being used to decrease the spread of COVID-19 don't really help when you're trying to filter out smoke out of the air. My recommendation is to try and avoid outside as best as you can. Obviously, I have children. It's very difficult to keep them inside.
You get it.
No, very much so. So the best thing to do is there's some thought that being out earlier in the morning, some of the toxins are a little bit lower level at that time. So it may be better to be out early in the morning. So get those kids outside and let them run right when they wake up.
Hey, one more just real quickly. Given the fact that COVID is hits your respiratory system, would being around this bad air make you more susceptible to developing the COVID symptoms or make them worse if you do expose yourself to that bad air?
Yeah, so the smoke in the air, the smoky air that you breathe in can cause that inflammation, and it makes that tissue more susceptible to picking up virus. So yes, we believe that the smoky air increases your risk of contracting COVID if you're exposed. That's one. And two, COVID affects the lungs, obviously. So that smoke that comes in when you breathe in the deep breath of smoke, that ends up causing worsening of any COVID-19 symptoms that you may have in your lungs. I also worry about the back end of this disease process. So our patients who are recovering from COVID, the patients who have been in the ICU and had really a tough go with it, now are being exposed to this smoke. And I think we need to keep a close eye on those patients. I wouldn't be surprised if we start seeing them back in the ER for exacerbation of their symptoms.
That's an interesting point. Man, 2020 just keeps on giving, doesn't it?
Oh, it's rough.
Yeah.
I just want to say thank you so much to the firefighters out there who are fighting these fires, and our hearts go out to anyone who's been either displaced or suffered from these fires.
Well, we couldn't agree more with you there. Thank you very much for the information. We appreciate it today.
Of course, thank you.